Hi, good morning all. Today I teach you about coronary artery disease. In this, it is the first section which deal with atherosclerosis and angina pectoris. You can see more detail about that. First of all, coronary artery disease. As you all know, coronary artery disease which is caused by atherosclerosis. Atherosclerosis in the sense is a slow progressive disease which begins in childhood and takes decades to advance. A plaque, otherwise we used to say a buildup of lipid or cholesterol in the artery wall form as a response to injury to the endothelium in the artery wall. As you know, atherosclerosis, it is a collection of plaque, otherwise we say lipid or cholesterol, which is accumulated in the artery wall that is further leads to complicated lesions. That is what the atherosclerosis. First we see what is atherosclerosis. When you take about the incidence rate, it is the most common cause of cardiac disease in United States as well as in the worldwide. It is a major reason for the cardiac disease. As atherosclerosis is an abnormal accumulation of lipid or fatty substance and fibrous tissue in the vessel wall. Vessel wall in the sense arterial. Okay. We can see about what are the risk factors of atherosclerosis, otherwise coronary artery disease. As everyone knows, the risk factors for coronary artery disease is categorized under non-modifiable risk factors and non-modifiable risk factors and modifiable risk factors. So we can see what are the non-modifiable risk factors. From the term itself, we can know non-modifiable because we cannot change these factors. Okay, and whereas the modifiable means certain factors that we can change with our lifestyle practices, or we can modify the habits and all. So the non-modifiable factors are hereditary. Hereditary in the sense genetic factors. Some certain things genetically transferred to the next generation. That is for the hereditary factor. Then age. As far we know, there is a age above 45 years are high risk for developing cardiac diseases. Then gender. There is also in the late adult or the in the adult stage, males are more risk for developing cardiac disease or atherosclerosis or coronary disease, whereas after the age of this menopausal stage, females are high risk for developing cardiac disease. Then modifiable risk factors. Modify first one is elevated serum cholesterol level. Otherwise, we say hyperlipidemia. So that is something the increases serum cholesterol levels. That is total cholesterol, triglycerides, HDL, and LDL and all. So that factor we can modify by the changing the dietary habits or changing the lifestyle of behaviors and all. Next is hypertension. Hypertension is increasing the blood pressure. That is also is modifiable or we can control that. Then cigarette smoking is a unhealthy habits people have. So cigarette smoking is a high risk. Otherwise, it plays a vital role in the developing of cardiac disease. So smoking supposed to be quit. Then physical inactivity. Otherwise, we used to say sedentary lifestyle. So sedentary lifestyle and physical inactivity, it will adversely affect the cardiac health. So that is also one of the modifier factor. And obesity, as you know, increasing the body mass index. Then diabetes mellitus, increased blood sugar level. So and a metabolic syndrome. These are the modifier factors which can be modified. Otherwise, we can avoid or we can treat or we can prevent these factors by our modifying our lifestyles. Then we see what is the etiology and pathophysiology of atherosclerosis. So atherosclerosis, as already said, it is a fatty accumulation or became the complicated lesion further. So it has a developmental stages based on that. The four stages are there. First one is endothelial injury. Second one is fatty streak, fibrous plaque, and finally it reaches the complicated lesions. In the picture itself, we can understand that. We will explain it further. First one, fatty streak. Fatty streak is characterized by lipid-filled smooth muscle cells. Then endothelial injury I didn't explain by why, because endothelial injury, the endothelial layer is the covering of our arterial wall. It is a smooth layer. It will help for the smooth flow of blood. Because of these etiological factors, or because of the risk factors, there may be a injury to the endothelial layer. That is the beginning of the atherosclerosis formation. Then fatty streak is characterized by lipid-filled smooth muscle cells. That is, as fatty streak of develop within the smooth muscle cells, a yellow tinge appears, usually observed in the coronary arteries by age of 15, and involve an increased amount of surface area as the patient ages. As you observe in your previous picture, that is, there is a presence of fat, that is between the layers of artery. The layers in the sense tunica intima, tunica media, and tunica adventitia. Between tunica intima and tunica media, there is a presence of fat that is normally appear among everyone. That is usually they start from the age of 15. Next is a fibrous plaque. That is beginning of progressive changes in the endothelium of the arterial wall. Normally, endothelium repairs itself immediately. As it is said, endothelial injury is a basic factor for this. If endothelial injury happens, usually it will repair immediately. But in the person with a coronary artery disease, the endothelium is not rapidly replaced, allowing low density lipoprotein and growth factors from platelets, which stimulate muscle layers. Further, what happens once endothelial injury has occurred, lipoproteins transport cholesterol and other lipids into arterial intima. Fatty streak covered by collagen, forming a fibrous plaque that appears grayish or whitish, which results in a narrowing of the vessel lumen and a reduction in the blood flow to the distal lumen. Finally, end up with a complicated lesion. Fibrous plaque grows, as you know, as time grows. Also, gradually the deposition of fat, lipids, and the platelets, everything will be increased in the affected area. So, in a gradual process, this fibrous plaque grows. Continuous inflammation results in plaque instability, ulceration, and rupture. Platelets accumulate in large numbers, leading to a thrombus formation. Thrombus adhere to the wall of artery, leading to further narrowing of or total occlusion of the artery. That is the stage we say it is a complicated lesion. It abruptly affects the blood circulation to the distal end, that is peripheral areas of the particular artery where it supplies. Then we see coronary artery disease. Till now we have seen about atherosclerosis, that is what is atherosclerosis and what are the risk factors and what is the stage of development of atherosclerosis. Then coronary artery disease. In coronary artery disease, if you see, it is classified into chronic stable angina and acute coronary syndrome. So acute coronary syndrome further categorized into unstable angina and acute myocardial infarction. So acute myocardial infarction is two types: non-ST elevation, segmental elevation MI, and ST segmental elevation MI. So non-ST segment elevated MI in the sense partially occluded by the thrombus. So ST segmental elevation is not happen. We cannot rule out in the 12-lead ECG. Then in this section we see about chronic stable angina. Here see what is angina. Angina is a medical term which denotes chest pain. So angina or chest pain is the clinical manifestation of reversible myocardial ischemia. In the sense, it is a warning sign. If we identify on time, and we can treat and we can reverse the myocardial ischemic stage. The precipitating factors are the situation where oxygen demands are increased. The situation, which are the situation where oxygen demand increases, the certain factors, the factors like physical exertion, tachycardia, dysarrhythmia, cold weather, eating heavy meal, stress or emotional stress. These situation, body metabolism increases and because of that, body demands more oxygen. So the pathophysiology says narrowing of arteries by atherosclerosis or arteriosclerosis that leads to increased demand for oxygen or a decreased supply of oxygen. Because of decreased supply of oxygen, there is a myocardial ischemia. As you know, our cells supposed to need adequate blood as well as oxygen. Also, the blood or oxygen, that is what carry the nutrients for our muscle layer. So when there is an inadequate oxygen, definitely the cells start to necrotize, otherwise start to die. So that is a stage we say myocardial ischemia. So what happens is myocardium becomes hypoxic within the first 10 seconds of coronary occlusion. Contractility ceases after several minutes. So further, it leads to myocardial cell become deprived of oxygen and glucose for aerobic respiration. Aerobic respiration means that is a natural oxygenation process in the cells. When it is altered, what happens, instead of aerobic respiration, it will start an anaerobic metabolism begins and lactic acid accumulates. When there is an anaerobic metabolism, it will secrete lactic acid. Otherwise, we say uh, glycolysis process. So lactic acid accumulates. So this lactic acid, it will irritate the myocardial nerve fibers. That is how we transmit a pain message to the cardiac nerves and upper thoracic posterior nerve roots. This is how develops chest pain. Then types of angina. What are the different types or characters of angina you can see? First one is a stable angina. Stable angina in the sense it is a predictable and consistent pain that occurs on exertion and is relieved by rest. So stable angina, it is not a fatal condition. Usually the patient can predict when the patient develop pain or which exertional activity it develop pain. So immediately if you take rest, the pain will be relieved. That is why we can predict and consistent pain that occurs on exertion and it relieved by rest. Next is unstable angina. Unstable angina is called pre-infection angina. It is a fatal one. Otherwise, it is a complicated one. Also, it is known as crescendo angina. So the thing is, symptoms occur more frequently and it lasts longer than stable angina. The threshold of pain is lower and the pain may occur at rest. That is, unstable angina, we cannot predict exactly when pain happens. Even at rest also, patient develops pain as well as the duration of pain is longer. Supposed to take immediate treatment. Next is intractable or refractory angina. That is a severe incapacitating chest pain. Then variant angina. Variant angina also known as Prince Metals angina. Pain at rest with a reversible ST segment elevation. Thought to be caused by coronary artery vasospasm. Then silent ischemia. The objective evidence of ischemia such as electrocardiographic changes with the stress test, but patient reports no symptoms. Usually patient will not sense chest pain. Usually this kind of disease found among the patient with diabetes mellitus because they affected with the neuropathy, so they won't sense pain. But the all physiological changes have happened and these changes will evidence in the ECG as well as treadmill test. Then what are the signs and symptoms of coronary artery disease, otherwise angina pectoris? Chest discomfort or pain. So usually it can occur anywhere in chest, most commonly behind sternum or poor localization. Pain may radiate to the back, arm, arm in the sense mostly we say the left arm, shoulder, neck or jaw. Described as pressure, tightness or burning sensation often precipitated by physical exertion or stress. Then also it is the clinical feature or the pain is associated with the shortness of breath, weakness, anxiety, diaphoresis, dizziness or numbness in upper extremities. This is the main character of the thing or the signs and symptom patient have angina pectoris. Main feature is chest discomfort or pain. Pain is a radiating type of pain. Also, as it is says, it is different type. Maybe burning pain, or they feel pressure or heaviness over the chest, or they feel tightness, and also the associated factors like shortness of breath. As there is a pain increases, patient develop shortness of breath, weakness, anxiety, diaphoresis, excess sweat, dizziness and numbness in the upper extremity. Next condition is the chronic stable angina. Chronic stable angina, which refers to chest pain that occurs intermittently over a long period with the same pattern of onset, duration, and intensity of symptoms. This is something an unpleasant feeling, often described as constrictive, squeezing, heavy or suffocating sensation. Does not change with position or breathing. Pain occurs substernal, but it can also radiate to jaw, shoulder, and down the arms. It will last only a few minutes, that is 3 to 5 minutes. And the ECG shows ST segment depression. This is what the characters of a chronic stable angina. Then what are the diagnostic measures for angina pectoris? As it is for every condition, basic history and physical examination is mandatory. Along with that, electrocardiogram or ECG, exercise electrocardiogram, that is treadmill test, otherwise stress test, and coronary angiography. Coronary angiography, that is the invasive procedure. We can exactly rule out the patency of coronary arteries. So the detail about these procedures were discussed in the earlier video. You can refer that if you want to learn more. Then the management for angina pectoris. First of option is short-acting nitrates, then long-acting nitrates, beta-adrenergic blockers, and calcium channel blockers are also ACE inhibitor, that is angiotensin converting enzyme inhibitors. Then we can see detail about each of that. First on short-acting nitrates. Short-acting nitrates, the role is it dilate peripheral blood vessels. So when there is a dilation of peripheral blood vessels, it will result in decreased systemic vascular resistance and decreased myocardial oxygen demand. When decreases the myocardial oxygen demand, ultimately it will reduce the anaerobic glycolysis and reduce the lactic acid secretion and decrease the pain. Then dilating coronary arteries. When dilating coronary arteries, it increases blood flow to the ischemic areas of the heart. So when the ischemic area gets more blood as well as more oxygen, the anaerobic glycolysis or anaerobic respiration converted to aerobic and it will reduce the chest pain. Then sublingual nitroglycerin. That is the sublingual nitroglycerin, that is usually the termed as isobate, which will relieve pain in 3 minutes. Then the nitroglycerin or the short-acting nitrates supposed to be kept in closed dark glass bottles. Then caution against is quickly rising to a standing position, in the sense the patient who takes nitrates, they have orthostatic hypotension, chances of getting orthostatic hypotension. So be alert for rising to a standing position from the lying position. Then nitrates used prophylactically before undertaking an activity. The next is the long-acting nitrates. Long-acting nitrates, isobate dinitrate and isobate mononitrate. Then it is available in nitroglycerin ointment. So this ointment we can place on the skin over a flat muscular area that is free of hair, so it is easily absorbable. Then transdermal controlled release nitrates, that is first one is reservoir, that is delivers a drug using a rate controlled permeable membrane, and matrix provides slow delivery of the drug through a polymer matrix, that is for the local application. Then beta adrenergic blockers, or we used to say beta blocker. The action of beta blocker is it decrease the myocardial contractility, decrease heart rate, decrease systemic vascular resistance. decreased blood pressure. So all with these factors that will reduce the myocardial oxygen demand. Thereby it reduces the chest pain. Then examples for beta blockers are propranolol, metoprolol, and atenolol. Then it should be avoided in patients with the diabetes, should not be discontinued abruptly. Then calcium channel blockers. Calcium channel blockers act as a systemic vasodilation with decreased systemic vascular resistance, and it will reduce myocardial contractility. The drug of choices are nifedipine, verapamil, and diltiazem. This is about the first section of coronary artery disease. Here I detailedly explained about atherosclerosis and angina pectoris. In that atherosclerosis, I explained about what are the stages of development of atherosclerosis, as well as in angina pectoris, the etiology, manifestations, pathophysiology, and medical management for angina pectoris. I hope you all understood about this, and further subscribe this channel, as well as you just follow my videos. Further section will be the regarding acute coronary syndrome, in that unstable angina and acute myocardial infarction. Thank you.